Welcome everyone. We're just going to wait about a minute or two just so that everyone can kind of get signed in. Welcome everyone. Thank you so much for joining us tonight. I'm just going to wait just a little bit longer just to make sure everyone has time to kind of join us. Okay, I'm going to start to kick it off. So my name is Aoife Breslin and I'm the Communication Manager for Sims IVF Group. Sims has three clinic locations. So we've one in our Clonskeagh, which is in South Dublin. We've one in Swords, which is in North Dublin, which was formerly known as Rotunda IVF. We also have one in Cork as well. And then we have a satellite clinic in Carlow that can cater for any bloods or scans in between your cycle. I'm joined tonight by Karen Ferguson, who is our nurse manager in our Clonskeagh clinic. So do you want to just give a wave and say hi there, Karen?
Hi.
Very good. So if you have any questions or anything like that, just please pop them in the Q&A box and Karen will be able to answer them at the end. So yeah, okay, I'll just hand it over to Karen now. And yeah.
Okay, I'm just going to share my screen. Okay, so hello everybody, thanks so much for joining. So I'm going to have a chat to you about the role of the fertility nurse specialist here in Sims and Clonskeagh and across all of our clinics. So we are made up of a group of nurses, midwives and healthcare assistants. We cover various departments within the clinics, so phones, emails, scheduling, ultrasound scanning, which is done predominantly by the nurses, sometimes the doctors, bloods, and also our theatre department as well. We have some trained ultrasonographers. So our scanning nurses and our ultrasonographers all have specific training in relation to fertility scanning. And then we also have a team of patient coordinators as well. So they are really helpful for us nurses and the doctors arranging appointments, sorting out billing, general queries. So if you do come for treatment with us, you will liaise with the patient coordinators quite a lot whenever they are organising appointments and things like that. So generally for across our clinics, you can make a self-referral if you're interested in having investigations or treatment. You can also see your GP. They can be really useful at the beginning of investigations or just to even have a conversation with to gain some, I suppose, some more education about what you can do before seeing a specialist. So they can start some initial investigations and generally provide some advice. Then if you do make a referral to ourselves, the first step is to have an investigation with one of our doctors, so our investigation consultation. There you will discuss clinic information. They'll have a chat with you whether you're by yourself or as part of a couple. They'll have a chat with you about your general history, your health, your reproductive health, gynae health if it's appropriate, surgical history, things like that. And then they'll plan some investigations. Now, normally this would have been done face-to-face pre-COVID, but currently it's happening over Zoom. But they're still able to gain all of the information they need. And then after that, the next step is to have an initial consult with the nurse. Again, this is currently a telephone consultation. There they can provide more information about the process and explain a little bit further about the investigations that you've already discussed with the doctor. And then following that appointment, we would generally advise you to start booking in some of the tests. Now, if you're by yourself, you'll be given the kind of advised tests that you should be partaking. And then if it's for a couple, you'll have tests on both partners. Following these tests, you will have a treatment consultation again with a doctor. So that's basically where they gather all of the information from the test that you've had and then come up with a treatment plan, generally, if the next step is to have some treatment with ourselves. And sometimes they would want to arrange further investigations based on those results or based on your history or based on potentially treatment that you've had elsewhere. So that treatment consultation is basically pulling together all of the different investigations that you've already had and coming up with a treatment plan. After that treatment plan is in place, now generally it's going to be for IVF, a process called IVF or a process called ICSI. Sometimes they do IUIs, which I'll go into in a little while, and sometimes they have more specific investigations and treatments based on your initial investigations. But that would all be discussed with yourselves individually as a couple with the doctor providing your care. After a treatment plan is made, you will have an appointment with the nurse. So that's a scheduling call, and that's basically to put into action the plan that the doctor has made for you. So it's to arrange a plan for your treatments and to kind of get some dates in mind and start booking in some of the first steps. But we would always do that at your own pace. So sometimes you find that people want to have their investigations, get their treatment lined up, and then maybe have a break or have a few things they want to do before they actually start treatment, and that's absolutely fine. If that's the case, we would still go ahead and arrange a scheduling call and then just decide about dates closer to the time. So the role of the nurse, it's a varied role. So generally we're here for telephone support, and we provide advice throughout treatment, before treatment, during treatment, after treatment. We also have emergency out of hours. So we're always available there if you do need any support or any advice throughout treatment. We're a patient advocate, so we're always liaising with the doctors, with the lab, the embryologists, we're liaising with the patient coordinators all the time. So we're always there for you whenever you need to kind of use us as a stepping stone towards a doctor for advice. So everything we do is guided by the doctors, and we're constantly going to them looking for advice and getting back to you, or putting you directly in touch with the doctors if that's relevant. And generally just supporting you throughout the process of treatment. We also provide education throughout. So during treatment, you'll be starting different medications. You'll be having kind of going through different steps to get to egg collection if that's the treatment that you're having. And throughout that, we will be showing you how to do your injections, kind of what to expect at each stage, what to expect at your scans and your blood tests, and basically being there for you throughout the whole process. So I wanted to talk a little bit about the investigations that we carry out. So if you're if you have a partner, or if you're coming through with a male partner, the first line of investigation for them would be a semen analysis. So this is generally done here in the clinic. At the moment, unless you live quite far away, we are getting them to bring the samples in from home, just again from a COVID point of view, but we would arrange that and give you instructions, or else you would attend the clinic here to provide a semen sample that would be analysed by the lab, and then the doctor would feed back to you about the results. Then moving on to female investigations. Now, generally we would do what's called an SIS, which is a specific type of ultrasound scan where they use saline to pass that through into the uterus and down the fallopian tubes. And that shows us if there's any abnormalities there, or anything that we need to know about, or if there's any blockages in the fallopian tubes. If you don't opt for an SIS, we would always advise you to have a baseline ultrasound scan. And that's where we would look at the uterus, look at the position of it, the shape of it, look at the ovaries, and just make sure that everything is as we expect. And it would also give us any indication about difficulties that we may run into during treatment. Equally, it can tell us if everything's likely going to be straightforward with treatment. And then for blood tests, generally we would do an AMH, which is also known as like an ovarian reserve test. So whenever we do a baseline scan paired with the AMH, that gives us a good indication as to how you're likely to respond to the drugs that we're giving you for fertility treatment. We would also do a TSH, which is like a thyroid blood test, a full blood count, which covers your iron and different things. And we would also check rubella immunity as well. Further investigations may be required or may be requested based on your specific history and the investigations that you've already had. But we will, as I say, keep you in the loop as you're going through, and we'll be able to provide further information if other tests are required throughout. Now, just moving on to treatment. So I have generalized this a little bit for kind of towards IVF or ICSI treatment. So for that process, generally you have a downregulation phase, then move on to a stimulation phase. So a downregulation phase is where you take medications to basically suppress your own natural cycle. And that allows us to have control over your follicles, which are little sacs in your ovaries, which contain the eggs. And then whenever you are what we call downregulated, or everything's basically shut down, we would give you stimulation medication to then stimulate those follicles which are in your ovaries. So basically, a woman, whenever she is having a normal natural cycle, she would ovulate one egg generally every month. And that's whenever a follicle within the ovary grows to a size where it's considered mature, and then the egg will be released, and that's a normal kind of ovulation process. But what we want to do is gather up all of those other follicles that are just kind of sitting there and wouldn't normally be released, gather up all of those with the medication, and then we would track this through. So you'll be having scans and you'll be having blood tests while you're on the stimulation medication, and that allows us to follow you through until you get to what's called an egg collection, where they would aspirate that fluid from the follicles. But I'll go through that in a little while. So downregulation and stimulation, you will hear those thrown about during treatment. Immune support is sometimes required for patients based on their investigations, and that would be can be oral or injectable medication. We also provide pregnancy support, so generally that's support with a hormone called progesterone, and we'll be advising you how to do that. Then DPS, this is just in relation to medication. So you may have heard of a drug payment scheme. So that's a scheme that's basically set up for paying monthly for your medications. So IVF medications are very expensive. With the DPS scheme, you pay a set amount every month, and then that generally works out a lot cheaper for you. And the last thing I wanted to talk about before moving on to kind of more specific treatment is EU bloods. Now, this is part of the legal screening requirement. Legally, we have to screen all patients coming through for HIV, hepatitis B and C. It allows us to safely store materials here in the lab. So we need to know if anybody is high risk for anything like that, any kind of transmittable disease we need to screen for. And that will be done at the beginning of treatment. So in relation to medications, there are a lot of side effects for women on these injections. So the main ones that we hear about are feeling tired, feeling emotional, headaches, sometimes nausea. The important thing to remember is that it is different for everybody. It's different for everybody based on, one, the amount of medication that they're taking, to how they're responding to that medication physically, and then emotionally how they're responding to kind of treatment itself, and the actual process of the physical side effects as well. So you may hear a lot about people feeling a little bit crazy whenever they're taking the medications. Now, we expect it. We are here to counsel people on those medications. It is hormones, so we are giving you more hormones than you would normally take in. So sometimes it's like a heightened sense of emotions. So we are here for you whenever that happens, if that happens to you. And again, it does affect everybody differently. So I want to talk a little bit about scanning, about our scans here in the clinic. So ultrasound scanning is a massive part of what we do as nurses here. Our doctors also carry out the ultrasound scans as well, but generally, if you're having scans through treatment, it will be done by one of the nurses. So this is how we monitor your response to the drugs. So it's a transvaginal scan that allows us to assess the ovaries and the uterus. So it allows us to have a good look at what's happening after you're taking the medication. So generally, whenever you're taking the medication, the follicles in your ovaries are responding and growing. And as you're coming through for treatment, we will be measuring those follicles and counting how many there are. The scans are done Monday to Friday in the mornings. We also do some blood tests whenever you're here for your scan appointments. And then we have a medical meeting with the nurses and the doctors at lunchtime. And then after that, we will call the patients with their blood results and coming up, kind of give them the next step in their plan. We also we accept external scans. So if you don't live close to Dublin, you can have scans sometimes done elsewhere, and then just send them through to us. We also have the clinic in Carlow that Aoife has already mentioned. So Claire, one of the nurses in Carlow, is just starting up doing scans for all of our clinics. So it's great. It's a link that we have and we're trying to continue to develop. But you can attend Carlow for different things. So you can attend her for the bloods, for the scans. They also have a dietitian based there as well. So it's a really good link down in Carlow. So this is jumping on a little bit, but after you have your treatment cycle, you'll have your ovaries stimulated, and then the final kind of step is an egg collection. So it's basically a procedure where they take the eggs from the ovaries. So we're stimulating the ovaries in order to get you to this point. So the egg collection is a procedure which is carried out under sedation. It is done here in the clinic in our theatre department by one of our doctors. We have healthcare assistants in the room along with them assisting them, and we have an embryologist there as well assisting them. So it's done under ultrasound guidance. We do them in the mornings so that the lab work can be done in the afternoon. It's not done under a general anesthetic, but it is done with very strong sedation. And we do recommend that you have some time off. So the day after the procedure, of course, and then generally we would say 2 days after that. So an egg collection is a procedure where basically they aspirate the fluid from the follicles which you have in your ovaries. So every follicle, once it gets to mature size, is likely to have an egg in it. We don't always guarantee that we get eggs from every follicle because that doesn't always happen. But as your follicle grows, so if you have a look at the picture there, as the follicles grow, the black areas are basically fluid-filled sacs, and then that's the fluid that is drained away during the egg collection. Generally, the procedure takes about 20-30 minutes, and as I say, you get some very strong sedation whenever you're in there. It's conscious sedation, so you're not completely asleep, but majority of people don't remember the procedure and they're very drowsy afterwards. So we would have the procedure and then you'd be staying with us for about 2 hours generally afterwards. You can't drive home, so somebody needs to be with you, and then we would generally advise you to take at least 1 day off work after that to recover. So after the egg collection, assuming that somebody is going to be having an embryo transfer, whenever the eggs are collected during the egg collection procedure, they're passed through to the lab. The laboratory staff will then put the eggs and the sperm together in the process of IVF or ICSI, and then they keep them in an incubator and allow them to fertilize over a period of 5 days. So on day 5 after your egg collection, you will be planned to have an embryo transfer. Before that, you'll be getting kind of follow-up calls from the lab and from the nurses sometimes just to tell you about the development of the embryos. But kind of in a nutshell, they put the eggs and the sperm together the day of your egg collection, keep them in an incubator overnight and allow them to fertilize. You get a phone call the day after your egg collection. So the day after your procedure, you get a phone call to tell you how many of the eggs have fertilized with the sperm sample. And then they monitor those embryos on in very specialized and very specific conditions and temperatures. And then you'll get another phone call, generally on day 4, to plan your transfer for the 5th day. Now, there are some slight variations with that based on the doctors or based on your conversation with the doctor and your treatment plan. So for this procedure, it's a little bit like a smear test. So they use a speculum, they pass a soft catheter through into the uterus, and then they pass 1 or 2 embryos generally back into the uterus. And then they take the catheter out, take the speculum out. It's all done under ultrasound guidance, so they know exactly where they're going with the embryo. And then you don't need to kind of take any time off work. You can go straight home. You don't need generally any sedation for that procedure. And there'll be a doctor, there'll be a healthcare assistant in the room as well, and there'll be an embryologist involved too, all during that procedure, which generally kind of takes 15 to 20 minutes. Another procedure I wanted to discuss is IUI. So that's intrauterine insemination. Now, this is something that we would sometimes carry out if a patient was coming through by herself and was maybe using donor sperm to get pregnant. And this is a process where we would prepare your body for the IUI. So we would basically monitor you with scans and with bloods until we see that you've got 1 mature follicle there, sometimes 2, and then we would give you medication to release that egg. So it's basically like a normal natural cycle with some drugs just to help. And then we would time when you're going to release that egg in accordance with whenever we're going to do the IUI, which is where we pass some sperm into the uterus. So the sperm sample, be it partner or donor, will be a prepped sample of good quality that gets passed into the uterus, and then we would do a pregnancy test 2 weeks later, and that allows us to know if the egg and the sperm have met and have fertilized. So that is, again, a day procedure. Generally, you don't need any sedation for that, and you don't need to take any time off work or anything either. So then just to talk about additional support. So the nurses are your main means of support, but as well as that, we have counselling. So throughout you can have counselling through our specific counsellors in the clinic. You can have counselling outside of it. I am an advocate for counselling. I think it really, really helps people. I don't think that you need to have it necessarily after a negative result. If you have a negative outcome, I think it's a really good thing to have before treatment, or even at the very kind of beginning of planning treatment, because it allows you just to deal with your emotions and know what to expect and have the tools to deal with sometimes the negative outcomes or the negative feelings or connotations that you can get throughout treatment. So I think it's a really good way of preparing yourself mentally for the struggle that you can sometimes face, because it is a difficult journey. We also have other support from a dietitian. So Sophie, who is based in Carlow, is able to provide advice, and this is a new service that we're just starting to roll out, but she will be able to provide advice before, during and after treatment as well. Acupuncture is something that a lot of people benefit from. If it's something that you feel like you would find if you feel like it's something you would find helpful, there are some examples on the website of people that we would recommend. If you feel like it's something you would enjoy, I would say do it. If it's something that terrifies you, then don't. It's a really simple thing. It can really help you relax, can help with some of the symptoms of treatment. Sometimes people find that they have headaches whenever they're on the particular medications, and this helps with those types of symptoms. So it's a really personal thing, but if it doesn't do any harm and it makes you feel good, then go for it. Meditation, things like walking, things that you enjoy. Generally, we would say just take care of yourself, support each other, talk to people, talk to us. If you don't want to tell your work or your colleagues or your family or anybody that you're having treatment, that's okay. We always do recommend talking to people, but we are here for you if you don't want to kind of tell people outside of this kind of bubble that you have here. So it is really important just to take care of yourself during the process, because it's not easy. It is difficult. It can sometimes catch you whenever you least expect it. But please do avail of the support that we have here in the clinic. We're here, even if it's just to complain to us or to have a moan, that's okay. We are here for that, and we are used to dealing with these situations and the very kind of specific things that treatment can throw up. So please do avail of us, because that's what we're here for. Okay, that's it. Thank you.
Thanks so much, Karen. I think we already have some questions there that have come in, so I'll just pop into them. So yeah, guys, if you have any questions, just pop them into the Q&A there, and we'll do our best to answer them this evening. So one of the first questions is to do just with, is there ways to improve quality of sperm?
Mm-hmm. Yeah, so generally for male and females, lifestyle is so important. So things like excess drinking, things like smoking, it can all be really detrimental to sperm quality and also egg quality. I mean, there is a lot of evidence to say that age is the main kind of factor affecting women's fertility, but also recently there's emerging evidence to say that it may also affect men's fertility to a certain extent as well. But generally, lifestyle factors. So smoking is the main one. It can be very detrimental to sperm quality. So cut down on smoking, try and cut out the alcohol, refined sugars, eat as much fresh food as you can, try and cut out as many processed foods. And then you'll see other things about kind of wearing tight underwear and things like that. So maybe I would say generally lifestyle advice is the main thing, but also see if you can so just to go back to it's a difficult one, sorry, but whenever I discuss or whenever I talk about tight fitting underwear, temperature, things like that is something that you'll see online. So sometimes things like cycling, people are told avoid cycling, avoid anything like that where you feel like the temp is basically raising the temperature.
No, yeah, perfect. You know. This is a good one. So about what does AMH mean and what is a normal range?
Yeah, so AMH stands for anti-Müllerian hormone. So basically it gives us an indication as to what your ovarian reserve is like, but also it gives us a really good indication to how much medication that you would need if you are having fertility treatment with us. So a normal range varies from you do find that whenever somebody's in their 20s, generally if it's normal, it will start to decline by the time they're in their 30 and then their 30s, and then it generally continues to decline into their 40s. So I don't want to give kind of a specific number for what's normal, because we would never really judge it just on that one number alone. We would do a variety of other tests. We would have a look at how many follicles you have and what your scan is like as well.
Yeah, perfect. Another one was like, what's the difference between IVF and ICSI? That's a good question, actually.
Yeah, so that's one of the things I was going to explain. IVF and ICSI, it's an umbrella. So IVF is an umbrella term for IVF and ICSI. The difference is what they do in the lab with the actual sperm and the egg. So whenever a man is coming through with a partner for treatment, they would have a semen analysis, and that allows the lab to look at how many sperm are there, what they're moving like, how they're moving, and how they look. Based on that result, if somebody has a normal sperm count and a normal semen analysis, generally they would have IVF. If they don't have a normal sperm count, or if maybe the numbers are quite low, or if the morphology is a little bit low, they would recommend a process called ICSI, and that is where the lab specifically choose the best sperm and actually inject it into an egg. So it's basically given that the helping hand that it needs. So it's to try and overcome the sperm problem that somebody may have.
Good. Then this one is just, I suppose this is a really individualized one. So like how many eggs are usually collected, and on average, how many are fertilized. So it really does depend on the individual, I think, doesn't it?
Really, really does. Yeah, it absolutely does. So there's such a wide variety. So sometimes people are coming through, we would kind of try to prepare people as much as possible based on their investigation. So if somebody has a low ovarian reserve, or if somebody needs quite a lot of fertility medications to get to egg collection, we would generally have a fair idea of that from the outset of treatment and try and counsel people towards that. So for some people, getting to egg collection alone is great. We would try and have a minimum of 3 follicles at least before proceeding on to egg collection, because not every follicle is going to have an egg in it. Generally, between 6 and 8 is generally kind of an average, but it does vary so much from one person to another, and I don't want somebody to kind of cling on to that, because it is so individualized, and sometimes you hear people getting a lot more eggs and sometimes you hear people getting a lot less. So it is a really, really individualized process based on your investigations.
Yeah. This is the twins question. So how many embryos are usually transferred, and can you request a number?
Yeah, you can request a number. Generally 1. We generally advise people to have 1 embryos transferred. Sometimes people have 2, so it's always a conversation you can have with the doctor. We are here just to provide you with all of the information that we can provide you with, be it the risks of having a multiple pregnancy. We're here just to provide you with all the risks. It's your choice ultimately at the end of the day, if you wanted to have a double embryo transfer, have 2 embryos transferred back, but we would be counselling you on the risks of that and the risk of having a multiple pregnancy. Twins, look, it's great, it sounds great, but medically there are more risks associated with it, and that's just the black and white. It's nothing to do with treatment, it's the risks associated to you in pregnancy and the fact that there's a higher risks. We know people have twins all the time and have no complications with it. We know people have twins and do have complications. So there's always going to be complications with pregnancy, but our job is just to give you the information that you need to make that informed decision.
Good. So this one is just like, what happens if you require a scan on a Saturday or Sunday during a treatment cycle?
That's fine. So we do scans on Saturday. We don't generally do scans on a Sunday because we never really need to, because we can do them on a Saturday. We also do egg collections most days as well. So, and we do transfer 7 days a week. So the way that we kind of can control your stimulation cycle, it's never been an issue, but we do scans on a Saturday as well. So because of that, we don't run into problems.
Perfect.
Embryo transfer is, if you fall on a Sunday, you fall on a Sunday. We're here on a Sunday, so we do it's something that we can't change. So we're open 7 days a week for embryo transfers.
Perfect. Is there less of a chance of getting pregnant using frozen sperm?
It depends on the sperm quality.
Mm.
So it depends on the situation. So if somebody used frozen sperm as a means of preservation initially, then their chance of getting pregnant with donor sperm, or sorry, with frozen sperm is likely going to be higher than if there's a reason that they froze it in the first place. If it's, for example, because of a decline in sperm quality, then basically it's a matter of comparing the frozen sperm with the fresh sperm that that person's producing at that time, but you're not necessarily at a lower chance at all. The vitrification techniques that they use today are so advanced that you're not at a less chance because of the sperm being frozen. But generally they would do ICSI with frozen sperm, but the lab are very specialized in that, so you're not at a disadvantage for that.
Okay. And so this one's a good question. So what's the process for same-sex female couples? So we do have a couple of options.
Yeah, so there's a couple of options for same-sex couples. It depends. It's a similar process to a certain extent. So you'd still have the same referral, same consultation with the doctor, and then based on you as a couple and what your plans are or what you've kind of already discussed, we would sometimes do investigations on both partners. Sometimes people come in with a really clear idea of who they want to get pregnant within the couple, and sometimes they don't. So sometimes it's a matter of having the conversation with you both and then making that decision. We have got something called shared motherhood, where one person would have the stimulation basically and have the egg collection and then create the embryos with their eggs and donor sperm, and then the other person would have the other partner would have the transfer and carry the pregnancy, which is an amazing option that we can do these days. But apart from that, if it's, for example, if it's just going to be straightforward IUI with donor sperm, sometimes you already know yourself who you want to try first, basically, having the treatment. And sometimes it's a matter of both of you having investigations and seeing maybe who's most likely to get pregnant between the two of you. So it's a good one to have a conversation with your doctor about, really, because it is individualized as a couple.
Very good. So this is just about the process of embryo transfer and what's the difference between a fresh one and a frozen.
Yep. So the difference between a fresh and a frozen is predominantly whenever you're having a fresh egg collection, the main difference is, a fresh transfer, the main difference is that you've had an egg collection that cycle. With a frozen embryo transfer, you're using an embryo that you already have preserved here in the clinic. So the process for getting ready for that is stimulating your body, but to a lesser extent. So we don't need to do anything with the ovaries because they've already created the embryo in the past. So all we do is give you medication to get your endometrium, which is the lining of your womb, ready to receive the embryo. So it's a more straightforward process for the frozen embryo transfer. You would start some medications. You would have generally one scan, sometimes two. And then whenever we plan your transfer, it would be exactly the same process. So you would have the speculum, pass the catheter through, pass the embryo through. The process itself is no different. But the lead up to that day is very different based on whether it's a fresh or a frozen. So the embryo had been frozen and then will be thawed out for your transfer. When it's a fresh, it doesn't go through that vitrification, which is the freezing process. So for the fresh transfer, it's from the egg collection that you had 5 days previous.
Okay. So this lady, she's from Northern Ireland, and she's wondering, can she obviously attend our clinic? And she's done tests before, or does she have to start from the beginning?
You would still have to have the initial, by all means, you can come to the clinic. A lot of people have already started looking into their fertility before they come to see us. So those investigations are always useful and still provide a lot of information for the doctors. So depending on what tests you've had done, it's a matter of seeing the doctor, letting them know what the results are, sending them on to us, and then kind of based on what the results were, when you had them, how old they are, how recent they are, they would decide if you need to have any of those tests repeated or if we want to do any more investigations. So you can absolutely still use those results, and they're still very relevant and they still give us a lot of information. So yeah, it shouldn't make much of a difference, but it may mean that you just don't have to get some of those tests done again with us.
Perfect. Should endometriosis be checked for prior to IVF?
I mean, endometriosis is a tricky one because it's often so difficult to diagnose. Yes, I mean, ideally, that's ideally yes, but it's a really difficult thing to have diagnosed before treatment, and a lot of people know that they have it. Sometimes people have symptoms of it but don't have an official diagnosis. So it's a really tricky one, and again, it depends on your symptoms and what the severity of it is. It's not something that routinely would just be checked for without kind of symptoms or without kind of risk factors for it.
Is it possible to get an AMH test done only? Yeah, we do actually. We have a fertility testing package that kind of just looks at bloods. So yeah, you can get your AMH test done without a scan.
Absolutely, yeah. And it does give you a good indication. Sometimes it's just good for reassurance if you get a normal result. So if you have an AMH checked with us, you would get a call to discuss those results, if I'm right in thinking that, aren't I?
Yeah, you will. So we have a fertility testing package, which we can get it done as a couple or individually, and it's €300. And the female kind of gets an AMH done, her prolactin, and TSH as well, and then the male does the semen analysis, and you again get a call from your doctor afterwards with the results. So that's if you're just literally not ready to kind of go down the treatment route and you just want to check to see if everything's okay. So it is good if you're just literally just want to just get a checkup,
Yeah, it's really good if you get a normal result. It's great sometimes just for reassurance, but also if you're kind of unsure about fertility treatment, or if you've maybe been trying for a while but don't quite feel like you're ready for fertility treatment, and you have your AMH checked and actually you find out it's quite low, sometimes it's just what you need to kind of push you towards having more information or having more investigations done. And it is just sometimes the step that you need to make the step to having treatment if you feel like that's what you could benefit from.
Yeah. So we just have a BMI question there. So what's the max BMI to be in order to receive treatment? Well, we do recommend, I think it's under 30, isn't it?
Yeah.
But, yeah.
Yeah. So general NICE guidelines is under 30, but we would look at kind of somebody's general lifestyle for everybody coming through, no matter what their BMI is. We advise everybody that their lifestyle is so important. We don't turn you down really based on your BMI, but we would always be having the conversation about what kind of considered to be a healthy BMI technically. But I have seen in the past people who suffer from things like PCOS sometimes have difficulty losing weight. It really depends on the personal circumstances, but it wouldn't necessarily be something that would directly stop you from having treatment. But we would always advise you about your BMI, and if it is above what's considered the normal range, they would give you some advice on that as well. And we have the dietitian Sophie as well for whoever it is relevant for.
Yeah, sorry, there was a question there. I think someone was asking about how to get in touch with Sophie. So I can kind of send that on afterwards. We will have it up on our website. She actually did a webinar with us, which is live on our YouTube channel and on our website as well. So she did one with us last week. So if you want to check that out as well, there's some great information there too. Yeah, I think even if you Google Sophie Pratt, her website should come up that way, and you can kind of make a consultation that way. But yeah, we will have more information on our website in regards to that. Can you get a scan with your GP if you live far away?
Your GP, I think you would struggle to get one with your GP. Sometimes if there's other clinics that can sometimes, or like women's health clinics or ultrasound departments in the hospital, or GPs, I think it'd be difficult to get. It depends on your GP, but I think it'd be very difficult to get the scan that we need. It doesn't really matter where you get it, as long as we get a decent report about it, because we need quite specific information. So as long as you can give us, send us on a detailed report, then I don't see a problem with it. But I would always kind of ring us and speak to us first, just so we can give you the information that we need to know to make the decision about your next step. Because especially if it's during treatment, we monitor you really closely. And then based on that, we make the decision about the next step. So it is important to get that scan really accurate. So yeah, I mean, yes is the short answer, but it depends on where you are in treatment.
Yeah, very good. If you conceive successfully before, does this dramatically increase your chances?
Say it again, sorry if I missed that.
If you've conceived successfully before, does this dramatically increase your chances?
Unfortunately, no, it doesn't dramatically increase. It really depends on the fertility issue, if there is one. A lot of the time, we don't know the specific reason for not being able to conceive, and it's so frustrating, especially if it is what we call secondary infertility, which is where you already have a child. So it doesn't, unfortunately, dramatically increase your chances. But it does. So I think it does give you a little bit of hope to a certain extent that it has happened before. I think psychologically it helps a lot of people if they've conceived themselves before. But unfortunately, it doesn't mean that treatment's going to be the success rate with treatment is going to be higher for you, unfortunately. But again, I know I keep saying this, but it is very individual as well, and one person's success rate is going to be different to somebody else's based on their investigations and their fertility history as well.
Yeah. How long does the process usually take for IVF?
Yeah, so for IVF, generally, there's short cycles and there's long cycles. So there's different protocols that we carry out. Anywhere from 4 weeks, so to 4 weeks to up to kind of 8-9 weeks. Generally, IUI cycles are generally a bit shorter. They're generally kind of 1 month, and like what you would be from day 1 of your cycle up until the end of your cycle, and then a little bit longer on to pregnancy tests. So some regimes are quite short, so the stimulation can take maybe up to 2 weeks, and then you would have your egg collection and another 2 weeks after that until your pregnancy test. And then some stimulation phases need to be a little bit longer, and sometimes the doctor likes you to have like a priming or a down regulation phase before that, which adds a little bit of time to it. So it depends on what treatment the doctor has prescribed for you.
Very good. How long are results previously done relevant for, please? So I think they mean like maybe tests done previous clinics. I think it's 6 months, is it? Or yeah.
Generally 6 months. I mean, we would still take that information on board, and it still gives us a good indication. But for things like, say, for example, your thyroid, we would check that before treatment, and we like it to be within a certain level before treatment. And we would recommend, if somebody's having specific medication for their TSH or for their thyroid, we would recommend getting that checked every month. So it depends on the investigation itself. Other specific investigations we don't need to repeat if it's, for example, if it's a genetic test. Some of them won't, we know they're never going to change, so we don't have to repeat all of them. But things like AMH, we do generally like to have a more recent result, because if your AMH has dropped off quite dramatically, then we may need to tweak what we're doing with you and with your treatment. So we do try and check them quite regularly.
And is there any supplements you would recommend for male and female? I suppose obviously folic acid is a big one.
Yeah, folic acid, vitamin B, vitamin D are the main ones. The pre-pregnancy supplements usually contain all of the things that you need. So there are specifically designed treatments, specifically designed pre-pregnancy vitamins for males and females, and generally they would contain all of the kind of minerals and vitamins that you would need pre-pregnancy to prepare your body for conceiving. And they also have some male pre-conception vitamins as well.
Yeah. So can ovarian cysts stop treatment going ahead?
It depends. So sometimes yes, and sometimes no. So if it's a persistent cyst and we don't feel like it's going to interfere with treatment, then sometimes we do proceed. if it's something that you've never had before and we feel like it may cause a bit of an issue, then sometimes we would give you medication to try and either get rid of it, or we would give you a little bit of time and wait for you to have another period and see if that gets rid of it. So it really depends on the type of cyst that's there. Sometimes there are some medical interventions that you can have to help resolve it before having treatment. So it depends on the size and it depends on the type of cyst that it is.
Okay.
But it's not a necessarily no, you can't have treatment if you have the cyst. It depends on if we feel like it's actually going to make any difference or interfere with treatment at all.
Mm-hmm. There's just someone who was asking just for a little bit more information on donor sperm or donor sperm treatment.
Mm-hmm.
We do have a lot of information on our website. So there's, yeah, we can probably answer that offline, I'd say. So waiting lists, and there's about, I'd say at the moment, it depends on the clinics, but there is about a 4 to 6 week waiting list at the moment, I would say.
Mm-hmm.
A lot of these are quite specific, or they should be kind of more geared towards embryology team. So any of these questions that we're not answering tonight, you can send them on to the communications at sims.ie, and we can look at answering them more specifically offline. So I've attended Clonskeagh previously, and can I attend SOARS for next transfer? Yeah, we should be able to facilitate that. That should be fine.
Yeah, it might mean having a consultation in SOARS first, just so they can gather all the information they need.
Yeah.
And then obviously if does it involve transferring an embryo?
Yeah, exactly. So there's a lot of, some information there that would probably, so yeah, that's probably more, we need to, probably have a chat with you further on that.
Yeah.
Can we get some more information on the Access Fertility program? So yeah, Access, actually, if you go onto their website, Access Fertility, there's a lot of information there. So they do offer these kind of refund programs. But the best way is actually to get in contact with them directly, and they can kind of give you a bit more information, and you kind of fill out a form with them, and then you'll link back in with us but it is actually a great program in that sense. But there is a lot of information on their website, and just all the different because there's a couple of different programs that you can avail of. But yeah, check out Access Fertility, and all of our clinics are affiliated with Access. So yeah, I think that's mainly, we've covered a lot of the questions here. Like I said, some of the questions are quite specific, maybe more geared towards the embryology team or the doctors as well. So apologies if we couldn't answer everything, but I think we've covered a lot here tonight. So just thank you all for attending tonight. I hope you got something from it, and thank you very much, Karen, for your time.
No problem.
Okay.
Thank you.
All right. Thanks. Bye, everyone. Thanks.